Welcome back. You're watching Today, and in efforts to curb the spread of HIV, self-screening test kits have been released at nearly 400 community pharmacies countrywide. The Independent Community Pharmacy Association South Africa and Population Services International says that South Africa are driving forces behind this particular project. The kits, priced at under 50 Rand each, offer several benefits, including privacy and convenience, quick results and empowerment through knowledge. We've got the ICPA CEO Jackie Maimin, who joins us this evening for more. A very good evening to you, Jack, and thank you for joining us. Just give us a little bit of a background in terms of the ability for the opportunity for people to take HIV tests on their own in the privacy of their own homes as a way to not only see how many people are currently infected, but also to control the spread of this disease.
Absolutely, and good evening. Thank you for having me. So I think this is a very important project because, as we are trying to drive towards our 95 targets, which means that 95% of people know that they're HIV positive, we need to get testing. Now, there are what we call hard to reach populations. And these are people who don't really want to go to hospitals. They don't want to go to clinics. So we looked for a safe environment where they could be tested. And of course, this is in your very own home or even in your motor vehicle, wherever you wanted to do it. And to visit a pharmacy is also, there's no stigma attached there. So you can pop into the pharmacy. You could be going in there to buy a tube of toothpaste, buy an HIV self-screening test kit, take it home and test within 15 to 20 minutes. You can screen yourself for HIV. And this is so important because if you are then negative, there are ways to keep you negative if you are at high risk of contracting the virus. And of course, if you're positive, we really do urge you to come back to the pharmacy, get that diagnosis confirmed with a second test, and then we can get you onto treatment to bring your viral load down to a level where it is undetectable, which means you can live a perfectly normal life and you don't pass it on.
Yeah, let's speak about one of the criticisms in the past, because this is a conversation that's not new in South Africa when it comes to people testing for HIV themselves in the privacy of their homes, their cars, or any other space that they deem safe, that you would need the aid of a counselor or a psychologist should the test result come out to be positive. What's changed in that narrative that it is okay now to do it on your own, and should it be positive, then you go and seek medical attention from the pharmacy, a clinic, or I suppose a hospital?
Absolutely. There is so much information out there these days. And we also believe it's one of the benefits of actually doing it or by purchasing the kit from a pharmacy, because there is a ready source of counseling and information there. So firstly, you could actually ask for counseling before you take your test kit. And the whole idea of the kit being able to test at home is that it's confidential, but it doesn't mean that you can't have the counseling ahead of time. You can also go onto the internet. There is a lot of information out there. But I think the sort of take-home thing here is that HIV is not such a scary diagnosis as it was previously, and people are empowered, and that's why this is such an important project, because we want to empower people and say to them, let's get to know what your status is. If you're negative, let's keep you negative. If you're positive, let's get you on treatment straight away.
Let's talk about the costs, Jackie, if you will. How much does it cost for someone to buy the test? You did indicate that if it does come out positive, then they should get retested at the pharmacy or the clinic and then commence with a treatment if needed. But also, what is that process? Do you prick yourself with a little needle and dispense the blood somewhere? Just give us a sense of what exactly one would be doing should they decide to do this on their own.
Okay, so one of the barriers for these self-screening test kits was that they were expensive. They were 200 Rand, 175 to 220 Rand, which is expensive. So we brought them down to below 50 Rand, and we believe that this makes it a lot more affordable. Of course, if you don't have 50 Rand, you can still go to a government clinic and get tested for free. And I would urge anybody who can't afford to purchase a kit to do that. But what this kit is, these kits are third generation HIV self-screening test kits. It is blood-based, so it's a prick of the finger. The test kits are specifically for home-based testing. So they are devices. The finger pricker is a single-use device. So once you've pricked your finger, it can no longer harm anybody else. The whole device, once it's used, goes into a packet and you literally just throw it into the dustbin, because any of the blood products are locked away in the device and the device is quite safe. So yeah, that's it.
Yeah, and since the rolling out of this particular option for consumers and people in different communities, have you found that there's been a healthy appetite where more and more people are opting for the option of taking a test in the privacy of a space in which they feel safe?
We have been absolutely delighted with the beginning of this program. These test kits were rolled out about 2 weeks ago, and we have seen a tremendous response to the kits. People are coming in, they're buying them. Some are buying two so they can test their partners as well. And the thing is, we really do recommend that you test regularly as well. So yeah, we're delighted with the response so far, and we hope to continue. And as I say, our partner, PSI, they have been doing the work in the background to bring the price of these test kits down to this affordable level.
Yes, and you said something a little earlier, which I think a viewer might still have at the back of their mind, that once you start the treatment, the viral load reduces to a point where it's not detectable. Talk us through the treatment of HIV and how one gets to that particular point, but also, I suppose, protecting themselves from TB and other related illnesses that might come as a result of having HIV.
Absolutely. So if you screen positive with your self-test kits, come back into the pharmacy or go to a local clinic. The pharmacies all have lists of local clinics that can also assist you. You do the second test to ensure that it is actually a positive, confirms the positive infection. And then what we need to do is, from a pharmacy perspective, if you've got a doctor, we would contact that doctor for you. If not, we would refer you to a doctor or to a state clinic. You would be started immediately on medication. Of course, they would screen you for things like TB, and there are a number of iterations of this treatment depending whether you are TB positive as well. But if you haven't got TB, you will be started on what they call a fixed dose combination, an antiretroviral. And that antiretroviral, you will have a number of blood tests as well, just to make sure that your kidney function is all good. And as I say, it's one tablet a day. Within a couple of months, with the new medicines like dolutegravir, your viral load comes down incredibly quickly. And as I say, once it gets to a level where it is suppressed and undetectable, it's almost as though you have not got HIV. You cannot pass it on to any of your sexual partners, and you, as I say, can live a happy and long life.
Yeah. Jackie, a final question from me I have to ask. Does this still mean, or with the new developments that you've just described for us, that the pre-exposure medication does still bear relevance in society, PrEP as it's called colloquially? Tell us a little bit about that, and if even with what you've just described, it's still an important component of the HIV, the stigma, and of course preventing it.
Absolutely. I don't think anybody wants to take a tablet a day for the rest of your life. If you are a person living with HIV, then you need to take a tablet every day for the rest of your life, unless we discover a cure, which hopefully one day we will. So if you are negative, I would urge you to remain negative. And this is a PrEP absolutely still has a place in South Africa. The whole idea of this project is to keep people that are negative, and people that are positive to get their viral load down till it's undetectable. So PrEP, very important. If you've got a lifestyle where you are at risk of exposure to HIV, then you take PrEP. It's also a once a day fixed dose combination, and it is so reliable. You are practically guaranteed that you will not get HIV as long as you take it regularly and as directed. Of course, there are certain blood tests that need to be done and regular HIV testing. We don't ever want to put anybody on PrEP that is HIV positive. And yes, that's the whole idea. As I say, the only way we're going to get rid of HIV in this country is to keep people that are negative, and those that are living with the virus to keep their viral loads so low that they can't pass it on.
Thank you very much, Jackie Maimin, for that update. She's the CEO of the Independent Community Pharmacy Association of South Africa.